What's going on, everybody? My name is Tankard. I'm one of the patients that Dr. Moore has worked on in terms of testing out or working on my muscle tightness. Now, the entire experience was transformational from beginning to end, quite frankly. Before I worked with Dr. Morris, it was a situation where I had muscle tightness from the times I played sports. I didn't know what the muscle tightness came. Well, I didn't necessarily know how to solve that muscle tightness, even though I didn't have any major injuries, just based on sheer just wear and tear of my body, and my posture was adjusted as a result of it. And Dr. Morris informed me of that. She said you can always tell when someone has muscle tightness based on their posture. So it was about trying to figure out ways to release that muscle so that it can relax, and so that our own bodies can become more turn into its natural shape and its natural form. After the initial treatment, I noticed my legs. I had muscle tightness in my legs, or in my feet specifically. And after using the massage guns and the treatment that Dr. Morris recommended and used, I saw my legs become more parallel. And as a result, I saw my posture increase. I saw my comfortability in my walking just become a little bit better and become a little more fluent. I just came way more relaxed. It was like having a thorn in my side just be removed. It was like having a weight lifted off my shoulder. I became way more relaxed, and evidently it had an effect on my behavior as well, just interacting and whatnot. I became way less irritable. Now, in 2 weeks after the initial treatment, in 2 weeks' time, I went back and I noticed that I became like you were able to see more of a drastic difference outside the initial treatment, the day of or the day after. But even still, 2 weeks later, I got my own massage gun. I'm very adamant on being able to become more aware about your own tightness in your own muscles and how to solve it and how to stretch and how to be able to even communicate that to people about, okay, you have some tension here. I'm not an expert by any means, but having the ability to understand, like, yo, get your massage gun. You may not necessarily know how to use it fully, but get your massage gun so that you can at least sort out the muscle tightness on your own. So it will be interesting to see for this next 2-year follow-up how much we've grown as individuals, as well as how much we've grown collectively in terms of information, if there's any new developments in terms of progress in a specific field, just for informational purposes, so then I can continue to grow, continue to progress, and to continue to be more aware of my own muscle tightness. Thank you, Dr. Morris.
Okay. Mr. Tankard, good afternoon. How are you?
I'm good. How are you?
That's good. So it's been exactly 2 years since I last saw you. Yes. So how have you been feeling?
Good, truthfully.
Okay.
Good. Obviously, your body goes through changes, right? Mm-hmm. So it's knowing how to adjust to those changes and what needs to be done to try to make it as optimal as possible. But all in all, I've been very comfortable in knowing what I need to do in order to allow myself to be as complete as possible, at least in me.
And how have your pain scores been?
Low.
Low? What numbers would you say they are?
2, 3. No higher than 4. No higher than 4.
On a scale of 0 to 10?
Yes.
Perfect. Well done. Have you needed to take any medication at any time? All right, good. So here we are today, and you filled out your pain map. Mm-hmm. And from what I see here is this tightness in the shoulders.
Yeah.
T2.
Yes. I've been doing a lot of construction as of late.
Oh, okay, right. So that would involve the chest and the arms, and also in the shoulder blades. Mm-hmm. There's a little bit of tightness there. Mm-hmm. And of course, it's construction. You're lifting a lot of things. So the body and the glutes and the thighs. Yeah. Okay. All right, so what would you like for me to concentrate on today?
Shoulders.
The shoulders? All right. What makes them worse?
What do you mean? What makes the shoulders worse?
Mm-hmm. What types of things that you would be doing that would make the shoulder pain or shoulder tightness flare up?
Pretty much carrying cement buckets.
Okay.
I mean, screening buckets,
All right,
cement bags.
Right. How heavy are those bags?
I don't know. Heavy enough.
I mean, normally I think a regular cement bag is about 50 pounds. Yeah, okay. So, and how many of those would you have to carry in a day?
Not every day. So I just pretty much do it on the weekends.
Oh, okay.
So once or twice a week.
All right, fine. And anything that makes it feel better?
Yep, massage gun.
The massage gun? Okay. And how often do you use that on your shoulders?
Really and truly, I would say every 3 days, every 3-4 days. That's when I noticed that I need to be more attentive to it.
Okay.
But I pretty much do a whole body thing. But yeah, I use a massage gun pretty much every 3 to 4 days.
All right, good. And what do you notice happens after you've used it?
Way more relaxed, tensions released, way more calm.
Oh, so it even involves your brain as far as how irritated you are, because I'm sure as things get tighter,
You become more irritated.
you get more irritated.
Get more
with
irritated.
things, right?
Yeah. So it definitely helps in the approach to different things. My muscles are more relaxed.
That's important to know. So I'm just filling out what you're saying to me on the sheet so that we have this as a template. All right, so let's go and we'll look at the shoulders. Degrees, I take a picture there, and so on until we've got 4 quadrants, okay? All right, so here we go. All right, turn. Turn again. Last one. Thank you. Okay, come on over to the bed now and have a seat. All right, so this is what we see. All right, so as you see, both hands are more or less pointing in the front, rotated inwards, so that can come about from lifting a lot of things for many years. Both shoulders are sloped downwards, so that means something's pulling them down, right? And good. So wide base gait, which is very common for construction workers because they have to carry loads, so that's fine. And from the back, yeah, so there's a slight angle in that neck there. Okay, so let's work on that. Okay?
Yeah.
Good. So you've got reasons for your shoulders to be tight. So if you can lay on your back for me first. And I'm going to start with the vibrational massager. Look at that. Remember your feet were off to different angles? And they are perpendicular. Perfect. Well done. Keep up the good work with your stretches. Right?
Thank you.
Well done. All right, so I'm just going to cover this. Okay. All right, so I'm going to start with the chest. Put your arms by your side. And I'm going to start with the pectoral muscles because those are the ones that are doing the lifting. You see how tight all it is all in that corner? So let's loosen them up. See how that's just stops? That just shows how tight that muscle is compared to the other muscles. So there we go. And so what the massager does is actually physically loosen everything that's underneath it. Okay, so not too bad. You could think of it as a high-speed massage. Now let's go down to the arms. And you notice this is different to the massage gun because this is a higher frequency wave. So this is a vibrational, whereas the massage guns are percussion. All right? All your biceps would be very tight from having to do all that lifting. Let's go on to this arm. Okay, now I want you to turn your head to the side because the nerves to the arms and the chest and the shoulders come from the neck. So that needs to make sure there's not some tension in the neck muscles that are cutting across the nerves to those areas, which would then irritate everything in those areas. So that felt okay on the right side. And turn your head to the right now. Okay, this. There we go. Ah, see, there's more tension in the left side of your neck. That would not go. Yeah, do you think that's experience more tension in the left compared to the right?
Yes.
Right.
Yes.
Yeah, so you see how it shows up in the massage areas, being more resistant to flow, to forward motion. So those are definitely tighter muscles in here than there are in the areas where the machine just flows easily. So that's something to think about when you're using the massage machinery. And so you pay more attention to the areas that have the higher resistance. Most of the times these are the areas that are more sore. But they get a very good response to the massage machines. Okay. Okay. How do your shoulders feel now? Bring your arms back down. Turn your head from side to side. All right. How does that feel?
Feels relaxed.
Relaxed, right?
Feels
Okay.
like something was done to it.
Okay, good. And then bring your shoulders up to your ears and down. How does that feel?
It's good. Feels mobile. Feels mobile.
More mobile, right? Okay, bring your arms to the center and with the elbows touching, right? And then all the way up. How does that feel?
Comfortable.
Comfortable?
Comfortable.
Okay, so keep your elbow, since the left arm was the left chest was the worst. Just have your arm like that, putting this one down, and I'm going to work on the muscles that anchor your shoulder down. I'm going to use this more powerful one. This is a percussion massager. And we're going to come from below and come all the way up. See how it's tight right in there? This is also part of your shoulder, but it's the underside of it. And this is what can cause frozen shoulders when all of this is tight. So, let's make sure all of these are not anchoring your arm down and pulling it in towards your chest. See how tight that one is? Yeah, that's your pectoralis minor muscle, which is used for pulling your arm in against that heavy weight. And for texting on your phone. Which is something we need to watch out for. See how tight that got? Because it just got shorter and shorter with time. And later on in life, you'll be hunched over like that. No, we can't have that. Thank you. Woo! All the way down your arm. That's how much that affected you. Okay, that's the left side. Bring this arm down, right arm up. It's the fact that you use your abdominal muscles to lift. I can't leave them out.
Yeah.
You see how tight they are? And that's enough to pull you forward as well. So that could cause back pain when these are all tight. So there we go.
I do have a question.
Sure.
So, if you work out, right, your muscles become tight when you work out. No? Yes?
Your muscles become tighter,
Tighter.
right? But remember, you have to have a balance. They can't get too tight because then they'll cause problems in the opposite area of the body.
Okay.
All right, so you have to look at a balance of, okay, the front muscles, I'm working on them, but I also need my back muscles to be able to balance out with equal weight of what I have strengthened in the front.
Right. I got you.
Make sense?
Yes.
Because otherwise you'll be lopsided, or, you know,
Yes.
it's you'll have issues with balance and symmetry, and thereafter function. See how tight even this muscle is, right? Going down the arm because of the chest muscles going across the nerves to the arm, and also use of that arm frequently for various tasks. Okay, so just loosening up all of these anchors. And you notice your left side chest muscles were tighter than this right side one, yeah? Okay. All right, let's see how this is now. A little looser. Let's see how tight that is? That's too tight. All right, so the abdominal muscles should be firm but not tense. This is tense. All right. Okay, put your right arm down. Okay, move your shoulders around now.
Yeah. I feel the difference.
All right. Okay, good. And now extend your arm all the way up and then all the way behind your head. Still some limitation there. Bring that one down and exchange. Right arm up and then behind your head. You see the right arm can extend further back than your left. So that just shows the asymmetry I was talking about. All right? So now, come sit up. And how do your shoulders feel now?
Usually, before, obviously I didn't work on the shoulders in the past, right? But what I would do is intentionally try to stretch my shoulders. Just if I hear a crack, I mean, okay, something's done, right? But now I don't hear a crack, so it's like, okay.
Okay, so you hear a crack when you put your shoulders back.
Stretch it.
Right, so that crack is one tight muscle going over another tight muscle. Almost like that, you know, making that sort of a sound. So that's good. So we have loosened those up. They're not fighting against each other. And now I would say if you do workouts involving these back muscles here, they would automatically bring your chest up and the shoulders in the right place and in line with your hips. Okay?
Gotcha.
All right, so we're going from a tightness score of 2 and 4. What would you say your tightness score is now? A 1.
Yes, no higher than a 2, 1 or 2.
There we go. And it is still some tightness in the muscles, as you see, because this was just a very short session. So congratulations.
Thank you, Dr. Morris.
You're welcome.
Thank you, Dr. Morris. Thank you.
Okay, so now what you have done, I purchased one of my books, and it's called I'm Still in Pain Now, What Can I Do? And then you go to the chapter 12, which shows about pain in the shoulder, which is... Then I will show you how to move your massage gun, but also all the different things that you could do at home for taking care of yourself and your shoulders. All right? How to find the problem areas, like how I found today, And if you go to the chapter section called Origin A, Arms Down Continuously, then you'll see a patient that's similar to you. And then on the page that has the treatment map, all right, so that would be page 170 in this book. Right, so there you have the diagram, and you'll see some arrows on there, and that's how you would run your massage machine. So starting from where the arrow is, the base of the arrow, then going towards the point of the arrow, and so you push your muscles outwards, and then follow where the arrow is. And then for the arm, you push the muscle up. Okay. And even on the back, if you have somebody who could do the back, then that would be good. Otherwise, you could just do like this, all right, to work on the muscles on the back of the shoulder. Okay. And then that's what you could do at home. And that's your homework. All right? And the diagram of why I have you moving the things in different directions is based on the layout of the muscles. So if you want to get an anatomy drawing of the muscles of the front, because I've given you the muscles of the back in here. And then you get the muscles of the front, and then that will show you which ones and which directions they are. Okay? All right. Any questions? Nope? Very good. And of course, you may be more sore tomorrow, so continue with what we had done last time as far as bathing in the Epsom salts to get the muscles relaxed, and stretching, like how we did on the table. So after you've done all the heavy lifting, stretch everything out. Or you could even do that before so that the muscles are warmed up. All right? Any questions?
No, Dr. Morris. Thank you very much.
You're quite welcome.